A family got in a car crash, and there weren't any serious injuries, but they still had to go to the ER to be assessed. They had a baby, and I just asked a routine question about his diet. The mother's answer made me so physically ill, I'll never forget it. The mother looked me right in the eyes and said, "He has juice. Just juice." She had heard that babies can start having juice when they hit the 6-month mark, but she got it wrong. The idea is to add juice to the baby's existing diet of baby food or milk, not to replace it entirely. Sadly, this lady had been feeding her son only juice for months.
My ex-boyfriend, who works as a ski instructor, once shared a terrifying story with me. He told me about a day at work when the ski trails were super icy, so he ended up with an influx of injured skiers. Amidst the chaos, he also took a nasty fall and decided to head back to the ski lodge for a breather. After a quick checkup, he thought he was okay. However, a passing paramedic noticed something alarming. My ex's helmet had severe cracks in the back. Sensing danger, the paramedic took immediate action. They got my ex onto a backboard and rushed him to the hospital. To everyone's shock, it turned out he had a broken neck and he needed urgent surgery. If he'd ignored it, he could have made the injury worse, leaving him paralyzed. Miraculously, he recovered, albeit with an unexpected outcome: a newfound case of acid reflux.
When I was working as a paramedic, we received an emergency call about a heart problem. We arrived to find a 90-year-old woman laid out on her back porch, and we couldn't say for sure how long she'd been there. She had countless health issues. When we checked our monitor, we found no heartbeat, and her hands and feet were starting to cool down. We thought we were too late, but her body's core was still warm, and her relatives insisted that she was okay just 10 minutes before we arrived. So, per our guidelines, she was still a candidate for revival efforts. We began administering aid, despite our gut feeling that she was already gone. But this was no ordinary emergency scenario. Establishing an IV line proved a grueling task. She had vomit blocking her airways, and our suction instrument failed us. A rookie we had with us botched the intubation effort, directing it to the stomach instead of the windpipe. To top it all, our meds spilled out over the place. It was absolute chaos. We tirelessly performed CPR for over half an hour, but there was no sign of improvement. Reluctantly accepting the fact that the woman had died, we contacted the hospital to inform them. We gently broke the news to the family that despite our best attempts, their grandmother didn't make it. Then we got a surprise. Just as we pulled our hands away from her chest, the monitor showed a pulse. We checked and confirmed her heart had a strong and rapid beat. In a whirlwind, we moved her to the ambulance, dialed up the hospital to retract our pronunciation, and dashed off at full speed. Usually, in cardiac emergency cases like this, even if we do revive someone, chances are they won't enjoy a good quality of life after leaving the hospital. Many tend to stay in the ICU for a few days before passing away for good. This woman was different, though. A few months later, we visited the same house on another call, only to find the same woman, alive, sitting on her couch. Although she needed a wheelchair, she was otherwise fine.
A man dropped by our clinic after doing some yard work, specifically after mowing his lawn. He claimed that something had catapulted from the lawnmower and smacked against his head, but he nonchalantly shrugged it off and pushed on with his chore. A few hours later, though, he still had a headache, so he opted to pay us a visit. We decided to perform a CT scan of his head, and what we found was downright shocking. We discovered an entire nail lodged in his brain. The only visible sign was a minute scratch on his forehead, and he was showing no signs of neurological issues. He was as clueless as we were astonished.
One of my friends was feeling significantly run down for several days. Regardless, he went to work, but he was always wiped out afterward. This triggered a cycle of returning home to sleep for an overwhelming 13 hours, and then going back to work all over again. Things got so bad that he finally decided to visit the emergency room. He ended up driving himself there around 3 a.m. one night. When he arrived, the security guard took one look at him and shouted, "Oh my God." He promptly brought over a wheelchair for my friend. The people at our admission had a similar response, and they ran to get the doctor so he could get immediate attention. The doctor observed my friend's alarming yellow appearance and ordered a blood test right away. The results were so disturbing that the doctor ended up doing the test twice. When the results from the second test confirmed the first, the doctor had to ask my friend for his emergency contact details. That's when he knew something was really wrong. Still trying to keep a sense of normalcy, my friend told the doctor not to wake his mom. Since it was still around 4 a.m., that's when the doctor solemnly revealed, "Your kidneys have completely failed." He got the entire medical team to jump into action. The doctor explained, "We're going to move you upstairs to give you a blood transfusion and dialysis. But we need to know who to inform if things go downhill. You're actually lucky to be alive right now." He continued, telling him, "You should have died a month ago." They set him up and he eventually got a kidney transplant from his sister, which luckily was a perfect match. He's now almost totally back to normal.
I remember one intense case from when I still worked at the hospital. A woman, fresh from labor, had to endure 4 hours of pushing before they performed an emergency C-section. Once we made it back to her room, I checked her bleeding level by pressing on her stomach. It seemed higher than normal, so I alerted the doctor. After he looked at her, it seemed like the bleeding was getting better. Then, the blood pressure monitor gave us a concerning reading in the 60. On my next check, what I found left me stunned. There was a continuous stream of blood clots. Thankfully, the doctor was nearby, and upon seeing her blood pressure, he promptly called for a massive transfusion. Returning to the operating room, we gave her substantial amounts of blood and fitted her with a tamponade balloon before transferring her to PACU for full recovery. It was just another nurse and myself on the team. Initially, everything seemed to be improving, but then things took a turn for the worse. She had excessive bleeding, her lips turned blue, her complexion was deathly pale, and her blood pressure dropped to the 50s. The doctor, busy elsewhere, sent his resident to check on her condition. Despite the situation, they advised just providing more blood. But I had an eerie feeling that things were about to get so much worse. I decided to call in the anesthesiologist for another opinion. This particular anesthesiologist had a reputation for being curt, but he immediately recognized the seriousness of the situation. He swiftly summoned the OB-GYN, quite forcefully, to check on her immediately. I felt newfound respect for the anesthesiologist, grateful that he took my concerns seriously. Ultimately, we returned to the operating room, where the woman needed an emergency hysterectomy. Chillingly, the doctor compared her battered uterus to a paper bag. Coming from an ICU background, I was no stranger to dire cases, but I confess I was truly scared this woman might lose her life. She suffered tremendous blood loss, almost 3 liters, and was placed on a ventilator before being admitted to the ICU for several days. I was so shaken by the whole event that I couldn't bring myself to visit her again. Being relatively new to the labor ward at the time, the incident left me feeling like the whole thing was too close for comfort, and with one wrong move or one moment wasted, we could have lost her.
My son's first encounter with the outside world was an unusual one. When he was just a day old, the nurse carried out a routine check on him. However, she couldn't record a temperature reading. Unsettled, she switched to a modern digital thermometer, to no avail. Next, she moved him under a heat lamp. That's when things got weirder. After a while, she finally got a temperature reading. However, the lack of initial reading was an alarming sign. A blood sugar test was done, revealing an astonishingly low level. Fear gripped everyone in the room as my son was moved to the neonatal intensive care unit. He stayed there for the next 2 weeks. They found out he was suffering from a genetic disorder. The disorder makes it impossible for his body to metabolize medium-chain fats, which means that fasting can literally be life-threatening for him. His body relies on sugar reserves. But once these deplete, he could lapse into a diabetic coma. That's exactly what happened just moments after his birth. In those early days, we faced a grueling nightmare. He didn't want to breastfeed or take a bottle, which would trigger his condition. As you can imagine, you can't exactly tell a baby he needs to eat or he'll go into a coma. For 18 long months, he had to eat every few hours, depriving my wife and I of any chance of a full night's sleep up until he was 5 years old. Whenever he came down with the flu and couldn't keep anything in his stomach, we ended up in the hospital for him to receive a sugar drip. But in the end, it all worked out. He's now 11 years old, tall and healthy, with no trace of any long-term effects from his birth complications.
I had a health scare that took me by surprise. I noticed some blood after using the bathroom that was more than I thought was normal. I went to the doctor, who examined my backside and told me I had irritated some hemorrhoids. He suggested I try baby wipes and use Preparation H. 2 days later, I felt awful with a terrible headache. That morning, I woke up just in time to go to work. I felt too sick to go in but went anyway, a decision that nearly cost my life. About halfway through my day, I passed out in the bathroom, and a coworker eventually found me. Paramedics rushed me to the hospital, noting that my oxygen levels were dangerously low. As soon as we arrived, they hurried me into a room. They told me that I urgently needed a blood transfusion. After I passed out again, I woke up to a nurse yelling. She was angrily asking why I hadn't been hooked up to the blood supply yet. It seemed that there had been a mix-up between determining my blood type and delivering the blood. I waited in critical condition for nearly 50 minutes, which made the nurse who found me really upset. Finally, the transfusion began, and I received 3 pints of blood initially, followed by another pint the next afternoon. They detected a hemorrhage and carried out a minor surgery. Thankfully, I've been healthy since then. The same nurse came to visit me post-surgery and told me how worried she was when reviewing my vitals during the handover from the paramedics.
A young woman, aged 23, was brought into the emergency room. She was struggling with sepsis following an unsanctioned kidney transplant. She had been on the waiting list for a legitimate transplant. But without any matches coming up, her parents took drastic measures. They traveled somewhere, they refused to tell us where, and bought her a kidney. Unfortunately, during the surgery, she contracted a very specific type and dire type of bacterial infection. This particular bacteria makes an enzyme that can eat up a wide variety of antibiotics, including the ones we use when dealing with persistent, resistant bacterial strains. The consequences were brutal. Even though we were giving her the best antibiotics we have, the bacteria was neutralizing them. The young woman subsequently contracted a secondary infection from bacteria in both her eyes, and while she survived, she ended up losing them.
During my time in surgery, I was in my trauma rotation as a resident. We received a pleasant young man who was brought in by emergency medical services. He'd been working high off the ground at a factory, descending a tower. At that moment, there was a sudden uproar from above and someone began shouting a warning. However, he had no chance to respond. The back of his neck got hit by something. Despite this, he remained calm, touched the back of his neck, and discovered a sizable chunk of metal lodged into it. His medical training instincts kicked in. He calmly completed his descent, sat himself down, and instructed someone to call for an ambulance. The item in his neck was a 14-inch wrench, with one end fashioned into a sharp, pickaxe-like tool. It was stuck there, right in the middle of his neck, between the C3 and C4 vertebrae. We could only perform X-rays since the metallic distortion interfered with a proper CT scan. When we saw the results, we were gobsmacked. Luckily, there was not a single fracture. His neurological examination was completely unremarkable. A superb spinal surgeon took the bold move to simply remove it. The patient was stitched up, had a soft neck brace for a week, and then he was back to his usual self.
On a sweltering summer day, a man suffered from heart failure. He was discovered unconscious, with no one knowing for how long. A passerby started doing CPR, and when the paramedics arrived, they took over. The paramedics performed CPR for almost half an hour. Finally, after 30 minutes, a miracle happened. They found a heartbeat. The person was rushed to the emergency room and later taken to the ICU. Once his condition appeared a bit stable, he was moved to our ward. Sadly, the person was in a vegetative state, unable to move or respond. Despite his condition, his family didn't want to give up hope. For a whole of 8 weeks, he remained unresponsive until one day when we got a stunning surprise. He woke up. We found him on the floor, attempting to crawl out of the room, removing his tracheostomy tube and various medical lines. He was thoroughly disoriented, and trying to guide him was a challenge. Unfortunately, the reality was sad, but very clear. He had sustained significant brain damage. But the story wasn't over yet. 5 weeks later, and he was ready for discharge, fully mentally competent and acing all cognitive examinations. The craziest part, he vividly remembered everything that happened before his heart episode. He said he was given a second chance at life, and he wasn't about to squander it. I'll always remember that patient.
We once had a patient who struggled with a chronic abnormal heart rhythm. He'd slip into ventricular tachycardia, which is fatal if not quickly treated. This means his heart rhythm was consistently out of sync, leaving him in need of defibrillation to revive him. If left untreated even for a moment or two, he could risk his life. We made a plan to use medicine, administered intravenously, to restart his heart in hopes it would help him, but it didn't work. Therefore, he absolutely needed defibrillation. Keep in mind, defibrillation is painful. If you are conscious, it's an unpleasant experience. As a precaution, we usually administer sedative drugs prior to shock therapy. Our patient, however, was facing another complication. He was struggling with addiction and often neglected the medications required to regulate his heart rhythm, deliberately attracting emergency cases. In those critical moments, there was hardly time for debate regarding drug administration. It was crucial to defibrillate him to prevent his slipping into a fatal rhythm. For the first few times we treated him, he was given a sedative. But soon, the doctors wised up to his antics and began the defibrillation without prior sedation. That's when we discovered the dark truth. He would recklessly toy with his own heart's rhythm to experience a temporary high. Having done it so often, it's baffling he survived. How he knew when to end up in ER, or how he managed to stay on the edge of danger without completely tipping over, is puzzling. Over the span of a few months, his actions led to him having a pacemaker implanted. The pills he was prescribed effectively slowed his heart rate or maintained a stable rhythm post-defibrillation. But the craziest part, all this could have been avoided had he simply stayed adherent to his medication. The pacemaker was installed as a preventive measure to stop him from exploiting his condition to access intravenous medications. The patient was essentially playing Russian roulette with his own life, and any instance could have cost him dearly.
A year ago, I had a severe infection in my foot. I went through a grueling 89-day course of outpatient IV antibiotics to treat it. Despite the intensity of this treatment, I just couldn't face the fact that the infection might have made a comeback. The doctors had warned me about this possibility because of the dead tissue in my bone. I was constantly tired, sleeping nearly 20 hours a day and couldn't do much else, and things only got worse. It reached a point where my wife desperately threatened to leave if I didn't get myself back to the hospital. So, I braved the rain, rode my bike back to the outpatient clinic, and checked myself in through the emergency room. When the nurse took my vitals, her jaw dropped. My pulse oximeter reading showed 68, while normal readings rarely dip below 90. And my blood pressure dropped sharply to 78/42. In no time, I was whizzed off by ambulance to a larger hospital. There, I was diagnosed as being septic and in the early stages of organ failure. My memories of this time are hazy, but I remember a very kind ER nurse. 2 weeks later, I woke up to a shock. I no longer had a right leg. A few days later, a nurse visited and shared that I was the most polite patient she'd ever seen in such a dire situation. She was glad to see me recovering.
I used to be a nursing student and worked as a nurse's aide at a hospital. There was a patient who was admitted because of a blood clot in her leg. The story of how it happened was chilling. She overdosed, fell unconscious, and her leg got pinned under her. She remained in that position for nearly 2 days before being found, by some miracle still alive. Her leg clot was due to it being trapped under her body for so long. She stayed as our patient for close to 6 months. Usually, patients are with us for about a week or so. During her stay, her weight dropped drastically because she wouldn't eat. Her hair got so tangled we had to chop it off. Her weight plunged to 90 pounds, which was dire for her height. Most of the time, she declined her physical therapy. It seemed like she didn't want to improve. She was also good at manipulating the medical team. She would demand painkillers, but refuse simple things like having her vital signs checked. Physical therapists would persuade her to get moving, and occasionally it would work. Eventually, she grew strong enough to walk with a walker. Her clot had been taken care of, and we discharged her to a downtown shelter. But we hadn't seen the last of her. In less than a day, she ended up in the emergency room of another hospital, and they referred her back to us. She continued her familiar pattern of refusing care and not eating for another 8 months. When she eventually passed away, she weighed just 68 pounds due to self-starvation. She declined feeding tubes. I doubt she would have survived as long as she did if it wasn't for the intravenous fluids. Despite numerous sessions with a mental health professional, she refused their assistance too. It was as if she'd already left us from the moment she was admitted.
One evening, one of our regulars paid us a visit in the emergency room. This guy, about 50 years old, was known for his drinking problem, which often got him into trouble with his friends and acquaintances. His repeat visits to the ER usually resulted from altercations, accidents, or some foolish act. But this time was different. Yes, he did once again end up in the emergency room because of a disagreement over money with a so-called friend. He was always hard up for cash, so the situation escalated into a fight. That's when things got ugly. The friend pushed him down, stepped on his throat, and whacked him on the side of the head with a crowbar before leaving him on a cold, concrete floor. An onlooker called the ambulance, and he was brought in. Despite his condition, he was able to walk and talk sensibly. He just wanted to have a smoke, munch on some snacks, and couldn't really grasp why he was brought into the ER. After all, he didn't seem to be in pain and only appeared to have some minor swelling. With fully functional eyesight, too. We chose to perform an X-ray just to be sure, and I helped him get onto the X-ray table. He insisted on doing it himself, but we wouldn't let him risk it. The results were grisly. His skull had essentially been cracked by the impact, splintered into small fragments, and a critical blood vessel had been ripped open. Luckily, he was saved by a 1 in a million shot. A tiny piece of skull bone had fallen into the open blood vessel, acting as a makeshift plug. If it weren't for that miracle, he wouldn't have survived long enough for help to even arrive. He was rushed to the intensive care unit immediately. 2 days later, he came back down to the emergency room to say hi to us and to buy some snacks, fully recovered from his ordeal. This guy narrowly escaped death, all thanks to a stroke of good fortune.
When I was 25, I found myself ill and housebound for nearly 2 weeks. In that period, I made 3 trips to the emergency room. This happened just before the pandemic hit Texas hard, leading the doctors to suspect it might be related. Apart from diagnosing me with strep throat, they didn't provide any additional treatment. But the antibiotic they gave me was ineffective. I was suffering from recurring high fevers that wouldn't subside. On my 3rd visit to the ER, they took my vitals. With a high fever of 104 and my oxygen level at 79%, I was transferred to a different emergency unit that could provide more intensive care. It turned out I was in a septic condition, and the combination of conditions that I had was a doozy. I was suffering from complications due to parainfluenza, pneumonia, strep throat, and Rocky Mountain spotted fever. My condition was so severe, it triggered multiple organ failure, particularly impacting my kidneys. Shortly after being put on a ventilator in the ER, my heart began to fail. The last thing I remember is being too weak to keep my eyes open. I managed to survive this dire condition thanks to dialysis treatment, and woke up in the intensive care unit a few days later with no other memory of the ordeal. A year later, I ended up at the same ICU. That's because I got my first job as a nurse there. My colleagues loved to tell me that when they first met me, they thought I wouldn't make it through the night alive.
Back when my wife was a medical student, she was involved with a teenage patient's case during her family practice training. The young girl had been experiencing terrible aches for about 10 days. Her parents, normally attentive, dismissed her discomfort, even though she wasn't one to fuss over nothing. My wife suspected appendicitis, but her supervising doctor dismissed it. He implied that the duration of the symptoms was too long for such a diagnosis. Persisting in her conviction, my wife managed to persuade her senior to arrange for some scans. The results were dire. The young patient had been living with a burst appendix for more than a week. Her abdominal cavity was riddled with infection, and there were clots forming in her arteries. Despite these alarming findings, her parents' reaction was infuriating. They hesitated to bring her to the emergency room at first. Eventually, though, they brought her in.
I had a patient who I'll never forget. He was struck by an explosion right in front of him. It was some kind of accident while he was welding, similar to a gas leak igniting the air around him. His companion had to drag him away from the scene. The injured man could only manage to stagger a few steps towards the rescue helicopter before he passed out from the pain. He was quite young, and when I first met him during the early recovery phase, he was in the burn unit. I couldn't believe what they both went through. His colleague, who had rushed to his rescue, was also there undergoing treatment for burns on his leg. The poor guy was suffering from severe burns, not just on his whole body but also his corneas. A couple of months passed by. I noticed a guy smiling at me during my shift. It took me hours, and that's when it hit me. It was the burn patient. He had bright red hair and green eyes, which I'd never seen thanks to the severity of his injuries. He was now capable of having conversations. He could sit up on his own, and even had the strength to eat. Witnessing his progress from being completely wrapped in bandages to this was simply mind-boggling.
In my previous career as a paramedic, I cared for a patient who had experienced a severe fall from a 6-story building. The accident had occurred while he was just spending time on the roof, not intentionally putting himself in harm's way. He had suffered extensive internal bleeding and a substantial concussion, but the truly remarkable aspect was his spine. Although the majority of the bones in his spine had been seriously damaged, miraculously, his spinal cord had remained unharmed. Every now and then, our paths cross. After spending roughly 5 years in a full body cast, he has made an impressive recovery. Last I heard, he's leading a happy life with his wife and 2 children.
A young lady in her 30s suffered a stroke. It caused a blockage in the basilar artery, a major blood vessel located at the base of her brain, responsible for essential functions like breathing and consciousness. I learned about her condition a day following the incident. Conventionally, her situation seemed utterly hopeless. It was as if she was already gone. However, due to her young age, they persuaded me to make an attempt to help her. I inserted a catheter into an artery in her groin and carefully guided it up to the blocked artery at the base of her brain. I then used this to deliver clot-dissolving medication directly into the artery for roughly 12 hours. Afterward, I checked and happily found the clot had disappeared. The next day, she was awake. Incredibly, after about a month, she walked out of the hospital on her own. It was the most amazing recovery I've ever witnessed. A month or so later, she sent me a beautiful card. I couldn't help but be irked that her handwriting was neater than mine, even post-stroke.
When I was 18, I got my first motorcycle. As I was leaving the dealership, the wildest thing happened. A sleeping driver crashed through the highway barrier, came onto the service road where I was, and hit me. I somehow made it through that without suffering fatal injuries. It was a freak accident, but I wouldn't let it deter me from my dreams of a big road trip on my bike. A month later, I got my second motorcycle, but unfortunately, trouble found me again. This time, at a traffic light, a drunk driver rear-ended me. That's when I kind of dusted myself off, said, hey, maybe this isn't meant to be. Maybe I'll wait a few years before getting another bike. But my ordeal wasn't over yet. A month later, I was rappelling when a poorly set anchor slipped loose, adding more rope to my line, which then jolted my back. I ended up in the hospital again. When I saw the doctor, I burst out laughing. He'd treated me for both crashes. He was shocked to see me unscathed again and said, bewildered, please tell me it wasn't a motorcycle.
I've spent my career working with newborns, particularly in the pre-EMI unit. What I've seen has been jarring. In my experience, some of these extremely premature babies appear very fragile. Their small heads are only about 2 inches from chin to top, with skin so delicate and thin it could almost be described as translucent in a reddish-purple hue. Their eyes remain shut, they show no signs of responsiveness, and their tiny limbs are even smaller than a finger. They're usually very thin, too. These babies often have to deal with lifelong complications as a result of their premature birth. I once questioned a doctor about why we continue to fight for these little ones when the situation sometimes seems so dire. The doctor's response always stayed with me. She explained, the preemies that were once seen as lost causes 20 years ago are now leading normal lives. That's why we never stop trying. It changed the way I look at everything.